The South African Health Products Regulatory Authority says it will allow a tightly controlled distribution of ivermectin for COVID-19 patients. The drug, however, will only be available in exceptional, compassionate circumstances. This follows an unrelenting campaign, to have the antiparasitic drug approved for use in South Africa. AfriForum and the National Freedom Party had threatened court action to force authorities to allow it to be freely prescribed. The health authority said it was aware of a growing black market for the product and hoped making it legally available would end the illicit trade. The health products regulator says there isn't enough clinical evidence yet to support claims that the drug is effective when one is facing a serious coronavirus case. Well, it has now been over a year since the outbreak of coronavirus in mainland China. During that time, there's been a lot of misinformation about the virus, with South Africa not spared from the myths and disinformation about COVID-19. Well, joining us now to discuss some of those that have been spreading in our communities, we speak to Senior Research Manager at the Human Sciences Research Council, Adlai Davids. Mr. Davids, good evening, and thank you so much for your time. It's interesting, because earlier on in the day, we heard from a billionaire and philanthropist, Bill Gates, who says, well, he's trying to investigate where some of the misconceptions and theories about his own involvement in COVID-19 may be stemming from. Are we able to understand yet where the general myths and misconceptions are coming from, especially given how quickly they're being shared on social media?
Well, thanks, Kathy, and thanks again for having us. Just to say that's exactly for that reason that the HSRC had engaged in or started a project to look at how exactly South African communities construct knowledge around COVID and who's most vulnerable, and at times how that then becomes and informs a discourse of both stigmatization and othering. And as you rightly say, social media has played a big part. I think the Director General of the WHO referred to it as an infodemic. So we also have not been spared it, because the way in which we construct this information is based on sometimes on limited data and what people read and hear others say. That is not necessarily scientifically validated or misconstructed and then passed on from person to person via social media, etc.
Of course, by and large, when it comes to the virus itself, we've had a couple of months to grapple with some of the misconceptions, whether it's around symptoms or, what leads to more serious cases of COVID-19. The biggest challenge that is emerging and is going to be a problem going forward is the misconceptions that exist around vaccines.
Yeah, our research, when we looked at a cross-section of people, and again, it's a qualitative study, so we can't get to everybody because of time and of resources. But we did get an insider information from a broad spectrum of people to try and get their perception of it. And what came out with regard to a vaccine is that already people were saying that there is already a vaccine available, even at the time when development of vaccines were at its infancy with regard to COVID-19. And I think what informed that was also that some people were saying that some of the test kits that were being used actually spreads COVID-19. And we haven't got, in our research, direct information about the involvement of personalities like, for example, Bill Gates. But the one that we found in our research is that the vaccine is already there, and that people are also showing us knowledge and information, misconceptions of vaccine hesitancy. And sometimes I think there's also informs vaccine anti-vax attitudes as well.
We've heard things like the vaccine is going to contain microchip cards that are going to be, injected into every human so that it's hard not to say it without laughing, right? So that the powers that be can have control and are able to watch and monitor each and every citizen who takes this vaccine.
Yeah. At the beginning, our results didn't really talk to that, but one of the posts that I saw is that exactly what would Mr. Gates want to do with the information of an 85-year-old granny who was the first one in the UK to get the vaccine. I think what is happening is that there's a general distrust. Our research didn't talk specifically about that, but it does it points to misinformation where people come across some information that has some relevance. For example, drinking a lot of water to be obviously to stay hydrated, eating certain foodstuffs, for example, like maize meal, would make you almost like immune. So the fact is that a good immune system depends on that you eat well, you are well hydrated, etc. But it doesn't translate into a immunity of getting COVID at all. And I think that's the kind of misconception and myth and construction of knowledge that then goes into these myths and misconceptions, and then sometimes also leads to stigmatization of people, and also of knowledge, incorrect knowledge about who is affected. And we see that especially young people thought that young people won't get infected, etc. Now, of course, a year afterwards, we know that's not the case.
How do we begin to undo these narratives and perhaps also ensure that there's a greater infiltration of the facts among the general public?
I think it's not something, again, that is raised in our research, but from a public health point of view, I think the more public figures come out towards to say that vaccines, people in prominent positions, like, for example, I think Emeritus Archbishop Desmond Tutu has indicated he'd like to be vaccinated, etc. The more the Minister of Health, Deputy Minister of Health, even people in high positions in the medical fraternity of the MRC and ICD, for example, has come out and say they want to be vaccinated. And even some of them participated in the clinical trials of these vaccine during the vaccine development. So I think that is something that we need to go for. The more information there is, the better. And coming from reputable sources, I think it does help that position. So again, when misconceptions develop, it's important that we know what it's like. And this is what our research has come up with. There's a way in which certain misinformation form and then spread. It's important to have a look at these so we can tap into it and say, how does one then construct our messages around treatment and whatever related to COVID, and especially with regard to the vaccine, how that is impacted. So it is a thing, and it's the kind of stuff where my colleagues who are science communicators are having a tough time and need this kind of research that we did to try and inform it and make sure that we do it regularly to make sure what's out there, what are people talking about, how is it happening. So yeah.
And certainly when you study the research, do you get the sense that with greater information, with greater clarity of what the truth is, many of those who are apprehensive about taking the vaccine could well change their mind?
Yeah, I mean, more people far more informed on these things, like we have on the MAC, for example, have been at pains to talk about the efficacy. Your inserts today about the importance of making sure that medications are safe and efficacious, etc. Those are the things that are so very, very important. And the same goes for vaccine. And for some reason, I think people forget that all medications have side effects. And the only plan is to try and mitigate against them. So it's another medication in the toolbox against COVID, right up there with masking up and sanitizing our hands and keeping social distance. So it's an important one that we have to get. So from a research point of view, getting to those myths and misconceptions, understanding how they are created with regard to vaccines now also is a very, very important task, because you'll get people who are hesitant for vaccines, as I understand it, that will say, well, let's see how it goes. Let's see what's happening to people in other countries that are getting the vaccine before us. And then, of course, there are people for other reasons that are just saying never vaxxers, so they'll never take the vaccine. So there's always but I think the people who are in charge of this, people like Professor Salim Abdul Karim, has been very clear of saying it always be forced to take a vaccine. But I do think that perhaps, it's important for us to evaluate it. But from a research point of view, again, how does these develop from one piece of information to become a myth and a misconception, and try just to speak to that in our awareness and our education campaigns regarding COVID in general and the vaccine in particular.
All right. Adlai Davids is with the Human Sciences Research Council.